beginning with reporter John Fenolio live in the KTLA5 newsroom. John.
Well, Sharon, Micah, today the U.S. death toll rose above 3,000. That's more than the number of people who died on 9/11. And now the White House and Americans are facing some harsh realities.
Brookdale University Hospital in Brooklyn has a shortage of everything, but coronavirus patients keep coming.
We need prayer, we need support, we need gowns, we need gloves, we need masks, we need more vents.
Ventilators. There aren't enough of them at Brookdale. There aren't enough nationwide.
You can think of it as your lungs being filled with fluid, like you're drowning. And once you get to that point where you're drowning, you need a ventilator to stay alive, and we're running out of that equipment for people.
As coronavirus continues to spread and the death toll sharply rises,
challenging times are ahead for the next 30 days.
President Trump is facing a grim reality.
Dr. Debbie Birx and I went in together in the Oval Office and leaned over the desk and said, here are the data. Take a look.
The data showed 100,000 or more people in the U.S. could die from the highly contagious respiratory disease. Already, more than 3,000 dead. More than 163,000 known infections nationwide and growing. The federal social distancing guidelines the president had hoped to ease now extended another month.
A month ago, nobody ever heard of this. Nobody had any idea.
But that's not true. As early as January 8th, the CDC issued an urgent warning about a cluster of pneumonia of unknown origin in Wuhan, China. By January 20th, the U.S. had its first identified case. Predicting a need for ventilators also not a surprise. The CDC warning of a shortage as far back as June 2017.
What do you say to Americans who are upset with you over the way you downplayed this crisis over the last couple of months?
I'm very proud. It's almost a miracle, and it is, the way it's all come together. And instead of asking a nasty, snarky question like that, you should ask a real question.
With the worst yet to come and a possible resurgence of infections in the fall.
In fact, I would anticipate that would actually happen because of the degree of transmissibility.
Doctors and nurses are pleading with the public to help slow the spread.
Stay at home. It could end in the fall, it could end at the end of the year. But this is why we're begging everyone not just to only put that pressure on the emergency department, but also for everybody to help us to help them by staying home.
The president says more than 1 million Americans have been tested so far. He also says GE and Ford are working to make 50,000 ventilators in 100 days. Doctors and nurses say they need many more right now. Back to you.